Yat and welcome to Four Directions of Wellness. I'm Roberta Diswood. Twopahanishla, Sisakani Bashachin, Nakaidina Dashache, Hanani Dashanella. The Navajo Maternal and Child Health Project provides health information to mothers, expecting mothers, and their families and loved ones. The project strives to empower and support mothers and their families in receiving culturally appropriate health care before, during, and after pregnancy. With me today is Project Coordinator Amber Rose Begay. Thank you for being here. Please tell us about yourself.
Thank you for having me. Sha'e Amber Rose Begay Nishya, Hashkana Zohen Nishle, Takchini Bashichin, Tobaha Dashache, Nakaidina Dashanele, Natanines de Nasha do Kehashte, Diné College de Nashnish. I have two children. My oldest is 19. My little one is turning 11 soon. And I live and work here in Shiprock, New Mexico at Diné College with the Navajo Maternal and Child Health Project.
Well, thank you, Amber Rose, for being here today. In 2020 and now in 2025, the Diné College Public Health Department, along with other partners and agencies, assess the health and well-being of women and children living within the Navajo Nation. From these assessments came the Maternal Child Health Project. To start, can you tell us about the purpose of the project?
Yes. So the Navajo Maternal and Child Health Project jump-started with the 2020 Navajo Maternal and Child Health Needs Assessment, which I do have a copy here and I'll talk a little bit more about in a little bit. But we were tasked with completing this needs assessment for Navajo, and it was to include Arizona and New Mexico and Utah, if possible, data for mothers and children. However, it was 2020 at the time. It was during the pandemic, so we weren't able to get comprehensive data. However, we're able to come up with this, some priority areas that Navajo Nation should be focusing on, and we got the opportunity to get additional funding, and that's how the project started. Mm-hmm. So the purpose of the project is to address those priorities in the needs assessment, as well as just implement initiatives and efforts to help educate and promote the health and well-being of Navajo families overall.
So you talked a little bit about what the purpose of the project is, but could you share a little more about some of the findings from the assessment?
Right, yeah. So just to speak a little bit about the report, it does include demographic information. It includes an environmental health section because as some of us know, in our community, we do have abandoned uranium mines that exist. So there are studies out there that look at how that impacts health. And we also have sections for infant, child, adolescent, and maternal or women's health in the 2020 report. Unfortunately, we weren't able to get much disability data, so that's actually an area where we're focusing on for the 2025 needs assessment. But just some findings from the 2020 report, which include for infant health, we are doing well when it comes to immunizations and breastfeeding. Areas where we could improve, we did highlight at the end of the report includes infant mortality. Mm-hmm. So I think specifically sudden infant death syndrome was up there. And for child health, again, we're doing well in immunizations, we're doing well in nutrition, however, mortality again, mm-hmm. And that includes unintentional injuries. For adolescent health, mental health was a big area that needs to be addressed and improved. However, we're doing well in immunizations as well as nutrition and physical activity. Mm-hmm. We're doing relatively well when it comes to like prenatal care and breastfeeding. Mm-hmm. However, we just need to provide more education and support for families when it comes to getting prenatal care in the first trimester or early on in the pregnancy. And then also duration of breastfeeding was an area that we just need to be able to promote and support our breastfeeding mothers and families in providing the resources and information and education so they can continue breastfeeding beyond at least 3 months. Mm-hmm. Or a lot of women are breastfeeding, initiating breastfeeding at the start, but it drops down after 3 months.
And so thinking about other things, how do you guys address things like substance abuse, sex trafficking, and violence?
Right. This was an area where we realized there wasn't a lot of data available for. So actually, we have a committee that was able to provide us feedback on areas that we should be addressing. So it includes sex trafficking and violence. I do want to speak on substance use. We did find that for adolescents and children that it does increase with age. If you look in the report, you'll see that at the age of 8 it is high, and then it drops down when a child becomes 9, and then goes up again once they turn 10, 11, 12. So that was an area that we were surprised to see, but also with that comes mental health, just being able to address substance use and mental health as early as possible with our children.
And then also thinking about the family as a unit, how do you guys address father and paternal health?
Right. So in our work, even just with our project, we're called the Maternal and Child Health Project, but we don't want to forget the fathers because, in Diné way, every person has a role in caregiving of a child and bringing up a child. So, in this work, we realize how important it is to also support and uplift fathers. And there's a lot of great programming and initiatives now that are providing that support to fathers. So, and then also grandparents who serve as caregivers. So we do our best. We're doing our best in the 2025 report to include any data that comes to paternal health.
So the needs assessment work group is quite impressive and involves several partners. Can you talk more about the committee and the meetings that you had?
Yes, I do want to give a big shout out to our committee. They are called the Navajo Maternal and Child Health Committee. So they're our steering committee. We were meeting monthly when we were completing the 2020 report. And right now we're only meeting quarterly, but they really help to guide and advise this process. They helped us understand what data we should be gathering, to where we could find the data. And so they're very vital in the needs assessment process, but our overall projects. They're made up of Navajo area maternal and child health stakeholders. So it includes, we have representation from Indian Health Services, from 638 facilities. So that includes, of course, providers or anyone who works with mothers and children. We also have a few that work in programming, so Navajo Nation WIC, and Johns Hopkins. Their programming as well addresses maternal and child health. And we have community. We do our best to invite community to our committee meetings, just to be involved and hear their input. And it's very helpful when we're planning at this this upper level, and we are able to get community voice and be able to address the areas that they're saying needs to be addressed. Aside from that, I do want to mention a few partners. We have a strong partnership with the Navajo Department of Health, including the Navajo Epidemiology Center, which helped provide a lot of the data for the needs assessment in 2020, but also in 2025. And we're trying to work with them now to understand our maternal mortality data. So that includes any death that occurred during pregnancy, and then after, up to a year after pregnancy, because that is a big area when it comes to addressing maternal health. Our maternal mortality rates for American Indian Alaska Natives is very high. So we're trying to understand what that data looks like on the Navajo Nation.
Okay, and so thinking about it moving forward with the project, what community efforts are you guys pursuing?
Yeah, so we have tried our best to be involved with the community. We do a lot of community outreach locally, and I actually have 2 other colleagues. One is in Saley, Arizona. The other is in Tuba City, Arizona. So we're spread out, thankfully, so we can try to reach any events, any health events that are happening. So we just try to basically set up and provide educational materials, which I did want to share a little bit. We did create a prenatal care campaign. So we created flyers as well as postcards and magnets. On the back of some of our materials, we have resources for prenatal care and birthing. So you'll see, of course, hospital facilities, as well as indigenous doulas that do practice here on the Navajo Nation. There is a Navajo Birth Workers Collective. I do want to give them a shout out because they do a lot of hands-on work with pregnant and postpartum families. If you see any of our materials, please do pick it up either for yourselves or for any relatives that may be pregnant or be thinking about becoming pregnant. Aside from that, we have done a lot around public service announcements. We've created a few audio PSAs that have aired on KNDN and KTNN. We also have a website that we're still developing, but it is live. It's NavajoMCH.org, and there it's very community informed. So anything that a community member tells us is needed, we try to implement. So for instance, we have mapping that we have done on special needs resources on and off Navajo, because we've heard from families that there are a lot of services that they have to seek off the Navajo Nation. We have our website, so please go check it out. We also have our social media pages, Facebook and Instagram. We try to reshare as much MCH-related information and events. We also have a podcast. It's called Healthy Navajo, and you can find that on any major streaming platform, Apple, Spotify, Google. And there we talk about the same thing. We're trying to introduce our project, get a little bit more visibility, but as well as those major topics when it comes to health. So one being congenital syphilis, to prenatal care, to breastfeeding, really any topic that, we can provide information and resources on. Aside from that, we have a lot of amazing projects and activities coming up. We're working right now to create video public service announcements, so kind of a step up from our audio PSAs, and we're really excited about that. We're working with an amazing media consultant who is going to take on that work for us, and so I believe that's it. Yeah.
Well, it's a lot of information that you've provided, but also a lot of information you're sharing out in the community. So another part of your community efforts is talking circles. Can you share a little more about that?
Yes, so we're working with a local doula. Her name is Shalia Benali. She is a full spectrum doula, and along with her mother, we are going to host talking circles in the coming months to talk about any topic relevant to maternal and child health, anything that community wants to discuss. But we hope to talk about prenatal care, breastfeeding, postpartum care, mental health, and nutrition.
Well, it's okay. It sounds really like something that the community might want to share more, and also to hear more about what's going on there.
Right, just to provide a space to talk things out and get, others' opinions, or just to relate to one another.
Well, I want to thank you, Amber Rose, for being here today. This has been 4 Directions of Wellness, Hagonet.